Okay, so we've got a huge opportunity, and Chanel, welcome to the team. Really good to have you.
Thank you. I'm so excited to be here.
Yeah,
Looking
yeah, this will
forward to
be
the new journey.
yes. It's launching today, which great. So what we're going to be talking about is the foundations of functional medicine. But what I'm going to encourage you guys to do, if you have someone who does marketing in your office, or if you have that person who crafts your emails or gets promotions out, get them right now and get them on this. What I'm going to share with you guys are ways that you can reactivate people who have not had their blood labs ran in the last 6 months. And so this is going to be really critical because we have this cool thing called fall coming up, and it's a change of seasons. And so one of the opportunities you have is to get your patients aware of the fact that it's time to get their blood labs ran again. And for those of you who have patients who are sitting on the fence, I'm going to share with you some things that you can do to get them into your office today in this webinar. So ideally by the end of this, you will say, okay, cool, we've got a chance to really get more and more people enrolled into wellness programs. And you can do that just by getting that day one handled with what we'll share with you today. So how many of you have concerns about your immune health right now? And we have in our Salt Lake clinic, just in 2 weeks, we've had 3 people out quarantined for the sniffles or the COVID variant. And so it's a time where everybody is actually like really hyper aware of it, because if you happen to get on social media, or if you open a newspaper, or if you turn on the TV, or if you just know how to read, you're going to see some kind of people talking about the variants and the mutations, and you're going to be asked for a health card like they're doing in Hawaii, which proof of vaccine. And so what I'm going to do is say, I think there's a better way of focusing on health. And that better way is, let's get on top of the immune system before it gets on top of you. And so one of the things that we've got is this immune reset health strategy. And so this is part of our Never Stop Healing series. And so as we go through this, you guys think about how you can craft a message to your audience so that they can actually get their blood labs ran. And I'm going to give you guys a little challenge here. How many of you have had your labs ran recently?
I need to go get mine done. It's been probably over a year since I had my last one.
Yeah, so it's time, right? And so our number one job at Go Wellness is to keep you healthcare entrepreneurs super healthy. And so the very first way to start is, don't play guessing games with your health. Let's get some labs ran. And so for those of you who've had them ran, great. If you haven't, got to get on it. So that's what we're going to talk about today. So in our 3-4-5 method, we have what we call this epic process of removing triggers. And so one of the very first things you want to do when you're looking to reset the immune system and get your body ready for whatever variant gets thrown at you is to start thinking about this EPIC process. Remember, EPIC is the acronym that stands for emotional, physical, immune, and chemical stressors. And so these 4 stressors are what brings down our functionality. And Cade, do you remember the model of health? We've spoken about that many a times.
Yeah.
And we actually just did a podcast on that. So if you guys want a great discussion on how to present the model of health to your patients, listen to our last podcast. Let's talk about this EPIC process. First of all, we have physical traumas that bring down the functionality in our body, and that allows us, these physical traumas are what allows our body to build up disease patterns. And so remember, a disease pattern, our body has to lose about 60 to 70% function before our body will manifest symptoms. Symptoms are the last thing to show up, and a definition of a symptom is just, it's a departure from normal function and a manifestation of an underlying disease process. And if you look at the definition of function, a function is just your body's ability to perform an action. And so, how many of you have had physical traumas that are unresolved? How many of you still have some pain conditions? Maybe you've had some regenerative medicine, but it's been over a year and it's time to get a little booster. Maybe you've had headaches, and those headaches are coming back because maybe there's some disruption in your hormones, or there's some nutritional imbalances that need to be handled. So the very first thing that we want to do is, do a complete evaluation, but we want to analyze how are you doing from a physical perspective. So the second one is emotional traumas. How many of you would say you've had some emotional disturbances? Because you think about that and you're like, well, how does that impact health? Well, the emotional traumas that we have, they start building up in our body. And this is where you can think of, people who've had PTSD, soldiers returning from war. You think about relationship breakups, divorces, you think about deaths, and these things tend to cause malfunctions in our body if they're unresolved. But yet in our society, a lot of us just push through it, and we never take the time to actually sit down and look at our emotional stressors. Cade, you got emotional stressors just from loss of sleep, right? I mean, having kids can be emotionally stressful.
Yeah.
What else gets thrown up in life?
Well, so one thing that I've noticed that is a big variable is moving. So moving and small kids. So like our 2-year-old Olive, she literally every morning when she wakes up, it's usually around 5 or 6 a.m. She's got a blood curdling scream. So that's like a great alarm clock, and she's like running into bed. And sometimes that's at like 2 or 3 a.m. But it's getting more normal at like 5 or 6 a.m. So that's a plus. It's getting better, but whew, yeah, that'll cause a lot of sleepless traumas.
Yeah, those things build up, and what we don't
Not to
realize
mention the
is,
adrenal overload when you hear the blood curdling scream.
yeah, and then when your adrenals get overloaded from a physical perspective, now you're not getting the mineral secretion, your blood becomes more acidic, your anion gap goes up, you don't have the charge. And what's interesting is even astronauts, one of the big dangers that you have when you're in outer space is you lose the electromagnetic field of the Earth. And so you'll literally go into heart failure if you don't have that electromagnetic pulse. And so with stress, you're basically taking the charge out of the pulse, which is one of the reasons we have such a high level of heart attacks. And heart disease still is the #1 killer. Almost 700,000 people a year in America alone are dying from heart disease. And I think a big faction of that, of the cause of that, I should say, is due to the fact that people are dehydrated. They don't have the right minerals in their body. And then the stress, even if they're putting the right minerals in their body, stress is just completely causing this lack of a charge to those minerals, and the body can't use them because of the stress hormones. So yeah, big ramifications if we don't fix our emotional stressors.
Yeah.
Chemicals, I mean, the EPA, we're exposed to almost 180,000 different chemicals every single week. And so how do these chemicals impact us, and where do they come from? Well, they come from our makeup. They come from our lipstick has a lot of lead in it, so that can build up over time. But not only that, but we get a lot of these chemical exposures from the food we eat and the air we breathe. We think about all the sanitizing that we're doing, and there's chemicals in the air now, far more chemicals than we've probably ever had. I mean, certain cities, they're spraying the streets with different chemicals just to slow the rate of infection. And it's like, well, what's that doing to our body's innate immune system anyways? And so these chemical stressors, just once again, they build up and they build up, and these malfunctions, from a physical, emotional, and chemical process, start to really cause our bodies to go into a disease state if we don't correct these things. And then the final area that we've got to look at, and I think this is one of the most important, and this is what we're going to be focusing on today, are the immune stressors. And so these immune stressors, those can be infectious exposures. These can be all of the emotional trauma. disengages our immune system. If you look at eating sugar, they've done studies where just by eating the equivalent of about 70 to 100 grams of sugar, you'll have white blood cells that go into basically a coma-like state for 4 to 5 hours. So that's pretty crazy, right, Cade? So now your body's, you're saying, well, I owe myself dessert tonight. And it's like, well, do you? Because, you're going to be more susceptible to getting, your white blood cells are going to be asleep, and you can get infected pretty darn easy that way.
Yeah.
Do you want to cry about that, Cade, or what? I mean, what are your thoughts? Because I just say don't eat it.
Well, if you can't tell behind my glasses, I have tears coming down my face because I just think sometimes you're just a dick. Like, why can't I just eat what I want?
Did you say I'm a hick or a dick?
Both.
Both. Oh man, geez, Cade needs another day off. Yeah, well, and that's how some of the patients are going to treat you. But if you let them know, like, hey, there's some ramifications from the foods that you eat, and you need to really be vigilant, because you cannot rely on any external intervention for your health. I mean, you've got to be self-resilient as possible. And yes, you need guidance, and that's what we're going to be talking about today: is how can we overcome these stressors in life? Because is anybody immune to these stressors?
No.
Not at all. I mean, the only way to inoculate yourself from emotional stress is basically a frontal lobotomy, and we just don't recommend that.
Right? Sometimes we'd like one, but yeah, it's just not.
Some days I'll take it. Yeah, I'll take 2 of those, please. But and there's no way of getting outside of chemicals. I mean, it's like, even your metabolic process, if you lived in the most pristine environment, there's no perfect environment. There's no garden if you can go escape to have this, pristine nature. All right, so let's move on. So the next one, this is where you talk about patient cases. 10 years ago, this is a patient of mine, Kelly. She lost her husband in an automobile accident. And this patient, when Kelly came to see me, she basically had every single one of these stressors that were just building up and building up. She could not get her health under control because, she had, started to gain weight. She was embarrassed because now she's 50 pounds above her weight. She'd actually gotten remarried. And so she just felt like, her ability to be romantic was just completely taken away, not only by the stress, but also by blending families. And then she starts putting on weight. She was tired all the time. She complained of dizziness, shortness of breath, especially when she exercised. Her sleep was interrupted by violent flashes of heat, and her skin was wrinkled. Her hair kept falling out. And she was asking me, does this sound like a thyroid condition, or is this menopause? I just need to deal with it, because that's all my doctors tell me is, oh, it's a menopausal symptom. And so what we did with Kelly is we said, look, we're not going to play guessing games. The very first thing we've got to do is get the right tests. Kelly's biggest frustration was that no doctors took the time to actually dig in and figure out what the underlying cause was. She felt like her doctor was bored. Every time she talked to her about this, her doctor's like, well, let's just keep taking your hormones. Eventually we're going to find some balance and you'll get caught up. But Kelly knew that there was something more going on. And so she decided it's time to take it another step further, and let's look at functional medicine. And so a lot of your patients have not heard of functional medicine. What functional medicine does, just like I said, with that epic process, when our body loses function, it's really important to see where those functional losses occur. And so our blood results, our blood work actually helps us regain those imbalances, so that your body can start functioning in a healthy fashion again on its own. So that's one of the things that we talked to Kelly about. We said, well, you've got 2 choices. You can continue down the conventional medicine approach. And, a lot of this is just going to be prescriptive medications. And when you get your blood work ran, it's based on establishing what disease you have. And I think this is the most critical mindset that we all need to make sure that our patients understand, is that you're not just here to diagnose a disease. And for those of you who love diagnosing, don't get me wrong, it's like one of the most important aspects of the overall process of healing. But unfortunately, a diagnosis will put somebody in a box and it doesn't establish causative factors. Hey everybody, Regan Archibald here with Go Wellness. And if you liked this episode, if it actually helped inspire you to be a better practitioner, help more people, establish a much better foundation for your business, then I'm going to ask a favor of you. And that favor is for you to share this with somebody you care about and love in the healthcare field. I don't mind if it's an acupuncturist, a functional medicine practitioner of any sorts, a naturopathic doctor, a medical doctor, any type of endocrinologist or specialist. We need to get this community strong, and we can't do it without your help. So I want to thank you from the bottom of my heart for all the hard work you're putting in and day out. I know it can be a grind, especially with some of the chronic cases that you're treating, but this show will help transform the way that you think, help transform the way you practice, and change the lives of thousands. Thank you for being part of our community.